we do have a graphic here of some of the warning signs of premature labor, and some of them are similar to normal pregnancy symptoms.
Right.
So, doctor, how do you decipher which are an issue and when is it not an issue? So, starting with backache.
Yeah. So the symptoms of preterm labor are the same as labor. Okay. So if you have...
It can be confusing.
Yeah, exactly. So if you have back pain, contractions, like we always say, 5 minutes apart or more, cramping and leaking of fluid. So if you're leaking fluid, like...
And by fluid, it's what kind of fluid?
Amniotic fluid. So we tell them, if you feel like you peed your pants, but you didn't, if you have increased pressure or discharge, if you see like you pass your mucus plug, if you see that you have bleeding, even if it's light, if you have contractions every 5 minutes or less, then you need to go to the emergency room.
Right. Now the vaginal bleeding, again, going back to the bleeding, is that an indication that there's something wrong with the baby? There's something wrong with
It could be, yeah. So if it's a lot of vaginal bleeding, it could be an emergency.
Right, and it's so scary and it's alarming for a mother, but the good news is that there are a lot of things doctors can do to delay a delivery. How are ways that you delay a delivery?
So we usually bring patients to the labor and delivery room, give them fluids. Sometimes dehydration can cause preterm labor.
Okay.
And we give them medication to stop the contractions.
Okay.
So we have medications that we call tocolytics, which can stop the contractions, make the patients feel more comfortable. Even morphine we give patients just to stop the pain.
Wow.
And that'll help the patients just relax and stop the contractions.
But with the use of the tocolytics though, will that allow the patient to go back home, or you're talking about patients have to stay in the hospital to be monitored?
No, it depends. If they haven't broken their water, we can stop their labor and they can go home.